Broadcasting live from the Business Radio X studios in Atlanta, Georgia, it's time for Atlanta Business Radio. Brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com. Now, here's your host.
Lee Cantor here, another episode of Atlanta Business Radio, and this is going to be a good one. But before we get started, it's important to recognize our sponsor, OnPay. Without them, we could not be sharing these stories. Today on Atlanta Business Radio, we have with us Lauren Bricks with Ipsum Diagnostics. Welcome, Lauren.
Hi, I appreciate you having me on the show today.
Well, before we get too far into things, tell us about Ipsum. How are you serving folks?
So Ipsum Diagnostics, we are located in Sandy Springs, and we are a clinical diagnostic laboratory. Prior to COVID, our specialization was in molecular diagnostics, so we were doing PCR and focusing on pathogen detection, so other infectious organisms, which is why COVID just fell really within our wheelhouse and of what we do.
So you were already doing things, obviously not COVID related, but things that were maybe rhymed with COVID, right? They were in the neighborhood of COVID-like things. And then COVID came, and then you're like, hey, I think we can handle this.
Exactly. We had, with the other pathogens we were detecting, you're working in the same, the biosafety level. So we already had all of the infrastructure in place because we're already working with organisms where you would need to take precautions and have things in place so that there would be no infections transmitted within the lab. So we obviously had to, implement some other measures, like with our current testing, we have to test our employees every day. So it's more rigorous, but in terms of the infrastructure of the company and, being able to adapt quickly for COVID, it was really because of the testing that we were currently doing.
So now at what point, so you're doing what you're doing before the pandemic, and then all of a sudden you're hearing, I'm sure, rumblings of COVID. Were you immediately going to, hey, let's see how we can plug in here because there might be some opportunity for us? Or was it something that after it had already been kind of spreading, then you were like, okay, they need us now to do something?
So it actually, with our, the testing program, we have infectious disease physicians as part of our program. And with COVID being a respiratory pathogen, before even in January, the concept really was, well, let's go ahead and develop this. It can be a big issue, but we need to be prepared for it. Now, there were things that we had to wait on, such as accessing certain genomic material and going through an application process to get access to this material because there are no, being new in the United States, there were no products that you could purchase for testing that were the specific PCR materials that you would need for COVID-19. So, but getting those pieces in place really allowed us to respond quickly. So when the CDC finally came out with the genetic sequence, and there was essentially, we were in a position that we could do the development probably for a private laboratory, in a very expeditious manner. But that being said, we were also dealing with realizing that the testing that was becoming available, and it was very limited, but some of the stuff that we the development work was we felt like, we have this high throughput instrumentation. We have 384 well plates. We're dealing now with, knowing that this is going to be, the whole country is going to be competing for these supplies. And so we were able to really make decisions that we would not, in watching, as the CDC came out with their kit, for example, it influenced us to make decisions. Okay, we're not going to use any of the vendors that the whole world is going to be fighting over, the same extraction kit. And so that really allowed us to consistently provide testing throughout the pandemic and not be exposed to some of the challenges that the supply chains have imposed on the labs.
Right, because you've already had experience in this kind of area, and then you were able to solve the problem maybe in a different way because you've been doing it so much in a different kind of solving a similar problem differently.
Exactly, and applying it to, okay, we do reference laboratory work. We understand looking at things from the lens of, you need a lot of samples to basically be in line and get through the door and be reported. And so, we as a laboratory, we already had the licensing to do what's called high complexity testing. So we perform what's called lab developed tests already. And so we're very used to test development. We're also these are our areas of expertise, also with the laboratory regulatory side. So if you're going to develop a test, what do you need to do to prove and demonstrate that it's accurate, that it's reproducible, that it doesn't have false negatives, it doesn't have false positives? And because these were all the things that we do anyway with all of our other testing, we were able to get through the FDA process in the time frame that we did, which was, I think that was one of the significant pieces to being able to get in and just hit the ground running, back in April.
So now you started doing the testing pretty early on, and then were you doing I guess there were two types of testing. One that had the big Q-tip, and then one is the less invasive Q-tip testing.
Yeah, so there are two different types of swabs, the oral pharyngeal and the nasal pharyngeal. And it's funny that you say that because we ended up putting stickers on every single swab that we would send out with OP and NP, because we'd hear people would grab the bigger Q-tip, for example, and sticking in people's nose, and that's very uncomfortable and has you just don't want that. So there were just some interesting dynamics that would only be the result of a pandemic. I mean, you would never, as a lab, have to label hundreds of thousands of swabs with a big sticker OP, sticker NP. So there'd be the visual awareness of they're grabbing so many. You're collecting and you're doing
right.
it at rapid pace. So these are the things that if supplies are coming from different labs, or you have different sets of supplies, these are all the things that can easily just get mistakenly used.
Now, can you share for the listener the importance of why it's important to be able to do this kind of testing quickly and get results quickly? Like, why is that such a big deal? So, with the pandemic, it's obviously you're talking about, again, a respiratory pathogen. And so in order to prevent the spread, you have to know who's positive. I mean, ultimately, your medical countermeasures that we have to have, if we don't have a vaccine, we have to have a test so that we can identify who's positive and have those people quarantined. That's really a mask in all these, you put all these measures in place, and they certainly, help. They do,
decrease the spread of it. But if you go and you look, I mean, people, you can wear the mask incorrectly. What type of mask are people using? I mean, so really until there's a vaccine, we have to have a way to, have accurate testing, and isolate the, people that are positive and make sure that they're reducing the spread of the virus by not, being exposed to other people.
And then if you test negative, that's still not a free pass, right? Like you could still spread it, right? Like that's not okay, you're in the clear. And even if you were in the clear for that test, like a day later, you could get it, right? Like it's not forever.
Right. So, first off, PCR is only, and I'm only right now, discussing PCR, but it's such a snapshot in time. So if you have a result and right now you're negative, that means right now at this moment of time, there, was no virus detected. That does not mean, and with any test, you have a limit of detection. So if you were exposed and you were the viral amount and it was not at what the limit of detection is for that test, you are going to test negative, and you could test again tomorrow and be positive. And so you're only talking about a snapshot in time. But with COVID in particular, it's everything, all the collections are happening completely outside the normal clinical setting. You're not in a doctor's office for the most part. You have people collecting, they're outside, they're in cars, they're in 90-degree summer heat. Your supplies are exposed to the sunlight. You've got all of these other factors that you never, ever have with normal clinical testing. You don't have patients self-collecting. That's unheard of. And so when you talk about a negative, you also have to consider the possibility of, well, was that an adequate sample? And so, like at our lab, we have what's called an internal sample control. And so we're looking at the amount of human RNA. And so in order to meet the criteria for a true negative, we have to know that the specimen had sufficient quantity of human RNA. Otherwise, if the virus is not detected and there's not human RNA or a trace amount does not meet our threshold, you have to recollect the sample. Otherwise, you're potentially reporting a false negative.
Right. And
that's just something very unique to COVID.
Right. So this is not only is obviously a pandemic an unusual occurrence, to the extent that it's going through, but just the way that we're all kind of trying to manage it, everything's not being done optimally. We're all doing the best we can under kind of trying circumstance.
Absolutely. And that's the thing is those are, every aspect of this is just outside of the norm. And so it's, whether it's everything from your supplies to the way samples are collected to, the types of end users that need testing as a laboratory, the number of patients that need the reports directly. There are all these very unique needs that are just very specific to COVID. I mean, I would say in labs, no other test is it if it rains outside.
Right.
That impacts the samples you get.
Right.
It's just
when you were going to school, they weren't teaching you what to do if it rains. That wasn't coming up, and that wasn't on the test.
Right. It's been very enlightening, that's for sure. Seeing how all these different factors that you just never think about directly impact everything that we're doing.
So now, who is your customer nowadays? Is it other kind of medical facilities, or is it like sports teams? Like they are all having to test every day now? Like, are those the folks calling you, the people that have to test every day? Or are you going to individual patients through doctor's offices? Like, who's coming to see you?
So we get our samples. So we do testing for the Georgia Department of Health, West Virginia Department of Health. But we also have hospitals, and we're starting now to get, we've been getting businesses when there was back to work testing. What we're seeing now is an increase in schools, because they're getting ready to, they're thinking about, well, our students are going to leave for Thanksgiving break. We want to make sure that they're negative and that they can all, that they can travel home. So it's just very interesting. Like I said, it's everything is, you're seeing responses that are very specific to what is going on. School starting, when the football season started in the different sports leagues, we started getting inquiries about testing. Production studios here in Georgia, we have a lot of film business, and these they need a different type of testing strategy, daily or weekly. So you've got all these different changes, that impact, who needs testing, why they need testing, and
how you're going to deliver it. Like, I mean, there's so many variables in play here. It seems like at every single step along the way is different than your normal way of doing business pre-pandemic.
You cannot say it better. I mean, I always say we created the patient portal, and we, as a lab, you have, your patients usually contact you if it's for billing matters or for medical records to be released somewhere. But that's, a limited number of calls. So when we developed the patient portal, and we did that specifically because with the back to work testing, people needed their reports right away. All of a sudden overnight, we had 5,000 people calling and emailing. Well, we didn't have a team of, 50 people ready to, be available. I mean, so you're having to implement all of these different solutions in, that things that normally you would have 4 or 6 months to do, you have to do it in 2 days. I mean, it's just, and then you have to do it within the confines of, we're a laboratory, we're regulated. So you can't just, how are you going to give people the reports? How are they going to verify their identification? How do we do it so that we're protecting their identification and their PHI? And so there are all these, I think serious regulatory aspects that have to get addressed. But then you're also dealing with, this incredible urgency. That's not, it's not an urgency. It's an urgency because you're talking about people that can't go to work. You're talking about people that, need to have a surgery the next day. I mean, so there's just a huge, huge amount of responsibility to, do it right, do it efficiently, do it in a way that, you are addressing, the purpose. So if you're going to have a patient portal, making sure that you are able, the patients can easily get the reports. And then you think about, you've got to have them, they need to download them because they're having to show them to an employer, or they might be going into a procedure, or they might be taking a flight. And so the other aspect of that was we don't order the samples. Our doctors or Department of Health or the hospitals are all ordering the testing. And so anytime there's like a typographical error, well, that gets corrected on the lab side. So all of a sudden you're like, okay, well, we know the percentage of people that have, that because we have to, if their name is Jon and their name was spelled John, well, they're not going to be able to take their flight.
Right.
So there's just, so you get you have to, be responsive and it's been very, it's been a ride. But,
well, I can imagine for someone and in your business, you have to be this super, OCD, check all the boxes. Everybody's got to be who they say. Like there's so many rules and regulations and compliance issues that you have to be perfect on. And then now the circumstances like, hey, I need this tomorrow. So figure out how to make this, this thing magically appear in my computer by the end of the day because I got a flight tomorrow. It must be stressing you guys out to no end. I mean, this is such a different world you've entered, but your skills are so needed. So it's got to be very challenging.
It is, it would not be without the people that the employees at Ipsum. You're talking about a team that is just fully committed, fully dedicated. It is the hardest thing imaginable. These are people that they're not seeing their spouses. They're not seeing their children. They're not going home and, relaxing. I mean, it was interesting because when everybody was in quarantine, we were, going 500 miles an hour. And so it's just, it's kind of like you have this team of people that really have just, it's been inspiring for me as, business owner, seeing how everyone has just really overcome these unbelievable obstacles. And they've really stayed, the focus and remembering, why it's important, why we're doing this. But having people that are just innovative and committed and passionate, our molecular lab manager, she has a master's in public health. So it's like, you have a team where it's like, they understand that there's a person behind every single sample who's waiting for their result, who's nervous, who's sick, who, needs to take a flight. And you just, a team of people that just understand that, respect that, and feel like it's important to do everything we can to make sure we're delivering an accurate result so that we can help each person.
Yeah, and as a leader, you must be very proud of the resilience of your team and the problem-solving ability. It just has to be a proud moment to know that your team is really rising to the occasion in this crisis.
Yeah, I mean, I would say that with COVID, no amount of money can get these solved, meaning it takes the people, every set of hands, whether it is the person that is handling the biohazard trash. You've never appreciated that function so much until you are in the lab and your biohazard trash is filling up faster than you can even, imagine. And you can't stop for everything. So it just really has demonstrated how valuable, how needed, how important every single person is. And you already know that, but for COVID, it really, you experience it. There's, every little thing, every time somebody, offers help when you are just at your max capacity, it's like a reminder of how amazing it's like and how thankful you are to have these people that are in this incredibly challenging situation, yet they make you wouldn't, if you were in the lab, you wouldn't feel it. You wouldn't feel, stress and tension, and you feel, teamwork and respect and gratitude. So that's what's really unbelievable to me.
So now what do you need more of? How can we help you?
Well, we actually need more molecular biologists.
Really? So, there's a shortage of those. Who would have thought?
Yeah. if they were ever in demand, so we have, we've been hiring throughout. That's one thing with being in Atlanta, for everything from courier drivers to the call center. We've been able to get molecular technologists. We've been able to get really wonderful people, and just even going from having to make 80,000 collection kits. These collection kits that the whole country was having issues getting. It was just like getting 24/7 production for these kits, and going from a company where we never made a single one of them to having to do 80,000 in a week. You're talking about Georgia residents, people in our community that have been part of this and helping. So it's really incredible.
Yeah, I mean, we say this around here is, with the right partners, you can do anything. I mean, it's amazing the way that folks come together and just, continue to rise up and, want to solve this problem and are committed and are doing what it takes to make it happen.
That's 100%. You can't do it without the team. And that's really one thing that's special is all this work is happening here in our Sandy Springs lab. So it's just everyone is, and we have employees that, live as far away as 2 hours away. So it's just been remarkable to have all the, these new people that have been hired that are working with, an existing team. And like I said, it's just an environment and the partnership and the collaboration is it's really remarkable how it's been, because it's unusual, but it's what makes Ipsum special. So, and it's what we wouldn't be doing what we're doing without the people.
Right. So now, if somebody wanted to learn more about Ipsum Diagnostics, what's the website, and who are the people that hire you typically?
So our website is www.ipsum, and that's IP as in Paul, S as in Sam, U as in umbrella, M as in Mary, diagnostics with an S at the end, .com. We do have an HR team, and we have a link on our website to the job postings, and they they're very responsive, but they change pretty quickly. So it's like every day there's a new position that we need. So
check the website because you're hiring, and microbiologists can cut the line, right? They get there. It just goes right onto your desk, I'm sure.
We have, and not just molecular, but we have a great group of people that actually came. They were graduating from Kennesaw State University, and so even for the laboratory, having lab technicians, so they can, med techs. So there's a variety of lab positions, right. And there's also administrative as well.
Well, that makes a lot of sense. Well, thank you so much for the work you're doing. It's important, and we appreciate you. And thank you, Lauren, for sharing your story today.
Thank you very much for having me and inviting me on here to speak about it. I appreciate it.
All right. Well, you take care, and thank you again for sharing your story.
Thank you. Have a good afternoon.
All right. This is Lee Cantor. We'll see you all next time on Atlanta Business Radio. And remember, this work would not be possible without the support of our sponsor, OnPay. Please support them so we can continue to share these important stories.
Today's episode of Atlanta Business Radio is brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com.